All right, Pam, you're up. What's going on?
Well, our community's health assessment and community health improvement plan have been the big things on my plate, in addition to the crisis diversion work that we're doing. So with the CHA, the community health assessment, we got a final product. However, Keith has been doing some public relations work with us, putting it in the paper. And he found an error in some of our data when he was going through it for this week's paper related to suicide data. So we're gonna have to have that amended for the final CHA.
Has it been printed?
It has been printed. Yeah, so that's discouraging. The thing that softens that frustration for me is that
Well, I looked
Our-
at that, I looked at that suicide
we
section
all
too.
did. We've had lots of competent eyes on it, so it was just one of those things that got past all of us. And
Or is anybody other than Keith gonna know
well, no one else has come up to me with it. I mean, I put it out to some small groups in the beginning, kind of for that, eyes on it kind of thing. And we did a few small amendments. In fact, we teased that this is our final, because we had to redo the final ones, but now it's a final. So, and yeah, I'm a little frustrated now because I have spent some money and have distributed it to people, so I'm gonna have to pull that back, and hopefully it'll just be one page that they have to change, and I can just switch that out in the stuff I've already copied. But one of the things we do this time of year is connect with all our schools and our long-term cares and our medical providers and provide them with a packet that has current reporting requirements and any other important and significant things we're doing. So the CHA is one of those. So we printed 25 of them, or plus for all of those folks. So fortunately, there's only been a couple of them that have been given out, but yeah, we have to go back and do that. So I found out about that on Friday. Well, Thursday maybe.
Doggone you, Keith.
So I'm hoping that the contractor will be gracious and maybe give us a little wiggle room with that final payment, but I don't know if that's gonna happen. We've had the three entities working. We've had DPHHS's Systems Improvement Office, Yarrow, who's our contractor, and us, and DPHHS took responsibility for it. They said that the spreadsheet that they'd given to the contractor had the error, but I'm not going to let DPHHS take sole responsibility. We all looked at it.
So
And-
I looked at it too.
Megan cannot take full responsibility for it, so. But we've moved into the chip process, so my goal is to have that chip done by the end of September, because I want it done before respiratory season starts. So I'm not sure how that's gonna work with our newest little encounter. But that's the goal, is to have the chip done. And so when they're both done, I would like to request that I can come to a commission afternoon meeting and present those
Great.
for the public. So maybe sometime in October, bring those in and do a public presentation on them, if that's okay with you guys. One of our responsibilities is to get that data out widely, which is why we're trying to share it wherever we can. And we did come down with the stakeholder group, which is quite extensive as far as having people from throughout the county and in different disciplines and different life experience. But the two priorities we're going to work on in this chip are mental and behavioral health, which that doesn't surprise any of us. And then the second one is access to healthcare and quality healthcare, which is going to pull in that EMS piece that we're struggling with too. The third thing that was identified as possibly a priority from all of those conversations and data that we gathered were our youth. However, we didn't get any primary data. so we didn't survey or talk to the youth. So I was a little hesitant to make a whole other priority category for them. We've talked about maybe trying to survey youth and talk to youth, but it's more complicated because they're minors. So we're gonna have some of our strategies related to youth instead of having a whole priority area related to youth. You know, some of the things we're concerned about with them do fall under mental health and healthcare access. So, but the other thing is these are living documents. So, and this one's for the next 3 years. So our goals are gonna be the end of 2027. So if we have time or see need, we can, you know, maybe do some more work on what's going on with our kids. So that's kind of where we're at with that. And speaking of kids, Aaron's back to school. Everybody's back in this week. Several of our schools have gone to 4-day weeks. Whitehall did a couple years ago, even the littles, and Jefferson High has been for a while. Basin's going to a 4-day week this year.
Oh, wow.
And, let's see, so I think those are the ones that we've got on 4-day weeks now. Cardwell considered it and opted not to. So
Boulder Elementary.
the interesting thing that's happened though, we've always thought that, you know, it might be harder for elementary schools with that daycare component. And I spoke with Hannah Neeskens. I had an appointment with her last week because we're updating our MOUs with the schools. And I asked her, you know, if that was an issue for them with, and she said they've got a grant to provide that childcare on Fridays when there's not school. And she said they have very few people that are participating in that. So evidently that's not been a barrier. So I don't know, maybe we'll see more of the elementaries look at that. I don't know, but Basin will start this year. Let's see, what else? We do have that tuberculosis case that we've been working with. They should be done with their treatment in October. The date's a little bit in flux because there've been some health issues that have prevented them from having treatment some weeks. So they have to have a certain number of medicated treatments in order to be released from the tuberculosis treatment. So we've been monitoring that. We get a daily message from them showing that they've taken the medication.
Are they at home?
Right now, currently they're in the hospital. But most of the time they've been at home, but they've got other health issues that have complicated things. So that's probably our most significant thing with epidemiology. That's not typical. We've had COVID surge the last little while. I don't know if you got my snapshot that I sent out for July because it bounced back from quite a few people.
I got it.
Oh, it did, yeah.
There was some sort of a IP's problem that IT's fixed for me. So be watching. It's time for our next one, which will be August. But we did have 3 long-term care facilities that had cases. That's usually when we really have that data that looks like we've surged because home tests aren't being counted anymore. So we don't even hear about most of them other than the way everybody else hears about it. So, so that's that. We had a really kind of a successful event at the fair. We did a raffle. We had some prevention money that we were able to use. And we bought some nice gifts, and I'm always preaching to them, you know, we've got to be educating and interacting when we're with our people. And so we did a raffle, and the way that they were able to enter the raffle is they participated in some sort of education with us. So we had education related to car seat safety, to safe sleep for babies, to our CHA. We talked about the CHA, and we had education related to CPR and AED training. So we had 4 different gifts and, they were drawn out and, they kind of went throughout the county. So that was kind of nice, but, we had staff meeting this morning and everybody was really pleased with that. And so I think that's probably what we'll do in the future. We usually table at Clancy Days, the fair and Whitehall, which gives us, a place in all 3 areas. So I think that'll be what we'll do next year again. This year it was kind of a last minute thought and idea. It was Aaron's idea and we hurried and threw it all together. And so now I think it'll be easier if we're gonna do it because we can kind of be planning ahead and looking for those appropriate prizes. But we gave away a grill, which was pretty exciting. People wanted that little tabletop grill. And then in association with Back to Sleep, we gave a sleep sack and some baby kinds of stuff, and it went to an expectant mom, so that was exciting. And then the car seat one, we had a kid gift, and with the CHA, we kind of looked at the mental health piece, and so we did a self-care basket for it. So we were able to buy things locally where we could and kind of supported our local businesses too. Jesse's been updating some plans. I think the bloodborne pathogen plan's probably gonna come to you guys if it already hasn't. We had that incident with the concerts, so kind of took a good look at it then. So he's been working on updating that. Molly's still teaching CPR, AD. We're trying to put Narcan in with that. We did have, we're part of that OD map notification system, and we got 3 notifications last month for Madison County with overdoses. So that's pretty close to us. So we kind of are watching that. But we're trying to make sure we're doing the Narcan training with our CPR training. And she's teaching Whitehall schools next week. So we've kind of got some folks who are wanting it. We've got, from the events we did, we've got a list of people in all 3 areas that are wanting it. We have moved into the ambulance barn that John Janik built, and he's got that conference room, which makes it really convenient for us to be able to teach there, not just CPR, but any kind of education we want to teach. I've had the opportunity to do a couple of, we're not calling it ACEs anymore, adverse childhood experience. We're calling it PACEs because we're talking about both positive and adverse childhood experiences. So I've had the opportunity to do a couple of those trainings, which I haven't done since pre-pandemic. So that felt good to get back doing some of that. And Aaron's doing a lot of QPR and SOS training. So lots of suicide prevention. I know that we had the elected officials and department heads do some mental health first aid a year or 2 ago. I don't know if you guys want to do like.
We should do the refresher.
Another one of those, or a QPR. QPR is a 2-hour one. But anyway, it might be something for you guys to think about.
Yeah,
We've got local trainers, and like I said, with the CHIP, that's going to be something that's, we're going to be setting strategies for that. And I think, that would be a good way for you guys to support and participate if you encourage county people to be participating in some of those offerings. I don't know, I guess we'll talk building expansion when Leah comes, but those are my things on my plate.
Mobile crisis response.
I have a meeting with Butte next Tuesday, and they did get their award. So we will know a little bit more about what that looks like.
We're a partner with four of them.
We're a partner. So what the goal is for Butte Silver Bowl to be able to take a portion of that crisis diversion funding and hire a full-time person. So we'd each get 0.25 of that person's time.
Right.
And they come into our county, attend our mental health LACs. We do a mapping project. And I've been talking to everybody that I want at the table for that, because we really do. I mean, we need EMS, we need you guys, because you've got, you're in a position to make decisions. We need law enforcement, we need schools, we need public health folks, we need medical
We want to do a good
providers.
job.
We do, we want to know what we can do, and, I mean, we need to have a realistic plan of what we can do in Jefferson
Right,
County.
right.
And then do the best we can. I also.
But that requires a match from us. That's,
It is.
the grant provides less than 50% of the money.
Right.
We read
It's
60%
right,
or something.
and it's not necessarily monetary. We don't have to come up with
Right.
money, but we do have to match services or, like my time or Tom's time or your time or buildings we use.
This person's time.
Right,
This
right.
person we're hiring.
Right.
That's the one I'm worried about.
Right,
but-
and what I really would like for this hired person, this
You
contracted
don't-
person to do is to train somebody from Jefferson County to take their place when
Right.
that 3 years is over.
Well, before,
And then
I would
maybe,
hope before.
right, then maybe we're in a position to apply for that or some other kind of funding to support that position on a local level. So that, we have our own.
We have our own
person.
coordinator,
Right.
not one we share.
And I don't know that we'll find that we need to have someone dedicated solely to crisis coordination, but maybe behavioral health coordination
Right.
that has crisis in that umbrella. That's what I kind of think, but like I said, we haven't done any of the strategic planning or mapping yet. And I think that's an important piece to figure out what we need to do, but there should be funding and resources to be able to do that piece of it.
But right now, any of the expenditures we have for mental health or substance abuse perhaps could be matched for the grant.
Yeah, yeah,
So
I mean,
the billboard and all
right.
our advertising stuff that we do,
right,
and
that's my understanding.
that's all matched for
Yeah.
so soft
And,
match for
yeah,
the grants. So
Our time.
I'm wanting to make sure, because we didn't put money in to pay this,
No,
so.
we won't be putting money in, but we need to make determinations about what's gonna go to that match, like with my salary, it all comes out of my
We can only
nurse
count the match
budget.
one time, you're telling me?
Right.
Okay.
And so I do that with my salary so that I can match my other grants.
They may not know.
So, I've got that 10% I have to match for FEP, so that comes out of my salary. I've got, 75% match on MCH, that comes out of my salary. So, my salary only goes so far before we can't tap it anymore. Yeah, and I would imagine they'll be watching what we're doing and wanting documentation on that. So we should be learning more next week, since we finally do have confirmation of.
And the
funding.
Helena and I've kind of just let that go for now.
They're
That-
over,
That's a
our-
receiving and stabilization
they are over our head. Bob.
contract with us.
They are way over our head, and they
Yeah.
still haven't given us any indication of what their service area is.
Yeah.
And that's what we need to know. How far are you coming into Jefferson County? And, but we don't have an answer that I'm aware of yet.
They got a meeting coming up again. I'll
Are you
try
gonna
to
attend?
get to it,
Yeah.
yeah.
I got,
But
in-
I think it's mostly a receiving and
it
stabilization
is,
contract.
it
I think,
is.
for
They're
us.
really, with their crisis money, they're really trying to get Journey Home back up and going. That's what they're trying to do.
Well, yeah,
Yeah.
no, for Many Rivers Whole Health is working on that too, so.
Yeah.
They,
Yeah,
they own the facility.
right. So that's kind of where we're at with that.
Good. It's moving.
We're making movement. I don't know that any of this is fast, but it's movement, and
Yeah.
that's important to recognize
The
that.
HB 872 committee's about to wrap up,
That's what I heard,
so they're gonna be making their
their
recommendations. and
recommendations.
I don't know that they were that strong for community mental health, to tell you the truth. I was a bit disappointed. But,
No, we,
I mean, they've done, so they, tried to increase rates for
Right.
providers, and they did some of that stuff, and they're pushing these mobile crisis grants. We can't fund crisis on grants. We need
No.
consistent
No.
funding for it.
the other thing that I'm doing in October is going to the Crisis Summit again, so we'll see if there's new information on that. Crystal's gonna go, and Dave Casola may go, which would be good to have law enforcement there. We, they're really, our first responders.
Yeah.
But I know when I talked with John Janik, last week, the governor came out to see his building. So we were invited to go because we are partners in that building. And then John and I had some conversations after, and they are struggling because their community integrated health, which is, that piece of EMS that's been given extra training to go and do some home visits and some support in people's homes. That grant is gone, that funding's dried up. So we're trying to figure out how to sustain that, because it's proven to be very valuable, especially where we're needing access to care in this county. And so I was talking with John and their crisis, or their community health, integrated health person, and that CHA is going to be helpful for them because they've got data, but we've really got to look at how we sustain things, because we provide services, and then without funding, sustaining them is a hard thing. So that was one of the places where I talked to John and said, I need you at this mapping table, because he said that they were being called by law enforcement to respond to some of, their calls, just because they knew they were mental health calls, or, things like that. So, there's a lot of people that are in this web of who we need to have input from. And we can't be siloed in all the things we do. I mean, I see that as kind of my job as the public health supervisor, is to be connective tissue, to bring all of the people together. Not that public health can do all these things, I can't, but public health is everybody's work. And, knowing what other people are doing and helping to bring those people to the table, and recognizing that we're all working on similar things, is what I see my job as. And, so anyway, I think, that's another piece that we need to bring into that table, Bob, is those community health workers and our
Yeah.
EMS folks.
Still looking for the mental health incidents in the county too, from
I know we haven't gotten any
Bozeman,
data.
yeah.
We haven't gotten any data from
if
them.
people said that we can get that right away. We can get that, and we haven't gotten
Yeah.
our thing from them.
Let me write myself a note.
So maybe Scott Malloy
Yeah,
is the guy that can get that done.
Scott Malloy.
Because that's gonna drive everything for us. I mean, how bad is our need, whether we need a quarter-time person or an eighth-time person, but can't hire an eighth-time person.
Okay. Do you have any other questions or concerns for me?
On that health survey that you did, it asked if you would be interested or not. Did you get folks that had an interest, that thought about wanting to be part of whatever that was?
We did get some, I'm a little discouraged that we didn't get more of our medical community that wanted to be, helping to lead, because a lot of what we're doing is around that, medical and mental health pieces. So we meet as a core group tomorrow. So that's the contractors, and then my people, so Drew and Barb and LaDana and Lindsay and Jim Murphy. So that's my core group. So we're meeting tomorrow to kind of look at where we're at, because the survey closed, and see, kind of where we're at. And then we'll have one more big stakeholder meeting, where hopefully in person, where we pull everybody together. It's scheduled for September 18th. You're more than welcome to come. We'd love to have you there. It'll be at the Volunteer Hall. I believe that's a Wednesday evening, 6:30 or 6 to 7:30. So anyway,
Come back.
so before we do a final, Chip, and I hope it's not a final, we'll pull everybody to the table and make sure that what we've got in there is what we're gonna work on.
And I left mine open. I didn't say yes or no.
Well, thank you for filling it out. I appreciate
That
it.
doesn't mean that, down the road.
Well, we're not final yet, so I know,
Sure that-
I know your number, Dan.
Yeah, exactly.
All right.
All right,
thank you.
Pam.
Thank you, Pam.
Thank
Did you have
you
anything
very
for
much.
Pam, Keith, or,
Okay,
No,
Spen-
no, I don't. Thank you.
okay?
All right. Well, I know Leah's coming in a few minutes, right? So
She's out there.
I'm gonna hang out.
Yeah, just go ahead.